Can I share a tiny bit from this book at this
Please.
point? I think it actually fits well. So I've only begun it. I am not yet vouching for the entire book. This is a book called The Body Electric, Electromagnetism and the Foundation of Life, published in, I keep on forgetting what the publication date was, and it's relevant, 1985 originally. Written by Robert Becker, MD, and Gary Selden. Becker is the lead author, and the introduction is written in the first person in Becker's voice. I just want to read a bit, because a bit from the introduction, the very beginning of the book, which is only about as far as I've gotten. So again, I'm not vouching for the entire book,
but you can't vouch for the whole book.
And I just the story that he begins with reveals, from 1985 already, how much a biochemical understanding of medicine had thwarted all of the other more holistic, more human understandings of medicine from actually continuing to do good on our behalf. Spoken from someone who saw firsthand the success, one of the main successes of a biochemical understanding of medicine. So here we go. Introduction, the promise of the art. I remember how it was before penicillin. I was a medical student at the end of World War II, before the drug became widely available for civilian use, and I watched the wards at New York's Bellevue Hospital filled to overflowing each winter. A veritable Byzantine city unto itself, Bellevue sprawled over 4 city blocks, its smelly, antiquated buildings jammed together at odd angles and interconnected by a rabbit warren of underground tunnels. In wartime New York, swollen with workers, sailors, soldiers, drunks, refugees, and their diseases from all over the world, it was perhaps the place to get an all-inclusive medical education. Bellevue's charter decreed that, no matter how full it was, every patient who needed hospitalization had to be admitted. As a result, beds were packed together side by side, first in the aisles, then out into the corridor. A ward was closed only when it was physically impossible to get another bed out of the elevator. Most of these patients had lobar, that is, pneumococcal pneumonia. It didn't take long to develop. The bacteria multiplied unchecked, spilling over from the lungs into the bloodstream, and within 3 to 5 days of the first symptom, the crisis came. The fever rose to 104 or 105 degrees Fahrenheit, and delirium set in. At that point, we had 2 signs to go by. If the skin remained hot and dry, the victim would die. Sweating meant the patient would pull through. Although sulfa drugs often were effective against the milder pneumonias, the outcome in severe lobar pneumonia still depended solely on the struggle between the infection and the patient's own resistance. Confident in my new medical knowledge, I was horrified to find that we were powerless to change the course of this infection in any way. It's hard for anyone who hasn't lived through the transition to realize the change that penicillin wrought. A disease with a mortality rate near 50% that killed almost 100,000 Americans each year, that struck rich as well as poor and young as well as old, and against which we had had no defense, could suddenly be cured without fail in a few hours by a pinch of white powder. Most doctors who have graduated since 1950 have never even seen pneumococcal pneumonia in crisis. Although penicillin's impact on medical practice was profound, its impact on the philosophy of medicine was even greater. When Alexander Fleming noticed in 1928 that an accidental infestation of the mold Penicillium notatum had killed his bacterial cultures, he made the crowning discovery of scientific medicine. Bacteriology and sanitation had already vanquished the Great Plagues. Now, penicillin and subsequent antibiotics defeated the last of the invisibly tiny predators. The drugs also completed a change in medicine that had been gathering strength since the 19th century. Before that time, medicine had been an art. The masterpiece, a cure, resulted from the patient's will combined with the physician's intuition and skill in using remedies culled from millennia of observant trial and error. In the last 2 centuries, medicine more and more has come to be a science, or more accurately, the application of one science, namely biochemistry. Medical techniques have come to be tested as much against current concepts in biochemistry as against their empirical results. Techniques that don't fit such chemical concepts, even if they seem to work, have been abandoned as pseudoscientific or downright fraudulent. At the same time, and as part of the same process, life itself came to be defined as a purely chemical phenomenon. Attempts to find a soul, a vital spark, a subtle something that set living apart living matter apart from the non-living had failed. As our knowledge of the kaleidoscopic activity within cells grew, life came to be seen as an array of chemical reactions, fantastically complex, but no different in kind from the simpler reactions performed in every high school lab. It seemed logical to assume that the ills of our chemical flesh could be cured best by the right chemical antidote, just as penicillin had wiped out bacterial invaders without harming human cells. A few years later, the decipherment of the DNA code seemed to give such stout evidence of life's chemical basis that the double helix became one of the most hypnotic symbols of our age. It seemed the final proof that we'd evolved through 4 billion years of chance molecular encounters aided by no guiding principle, but the changeless properties of the atoms themselves. One more paragraph. The philosophical result of chemical medicine success has been belief in the technological fix. Drugs became the best or only valid treatments for all ailments. Prevention, nutrition, exercise, lifestyle, the patient's physical and mental uniqueness, environmental pollutants, all were glossed over. Even today, after so many years and millions of dollars spent for negligible results, it is still assumed that the cure for cancer will be a chemical that kills malignant cells without harming healthy ones. As surgeons became more adept at repairing bodily structures or replacing them with artificial parts, the technological faith came to include the idea that a transplanted kidney, a plastic heart valve, or a stainless steel and Teflon hip joint was just as good as the original, or even better, because it wouldn't wear out as fast. The idea of a bionic human was the natural outgrowth of the rapture over penicillin. If a human is merely a chemical machine, then the ultimate human is a robot.
Oh my God.
1985. 1995, and I'm going to go back and read that one sentence that you and I both responded to that may be subtle if you aren't steeped in the problems of modern science. Medical techniques have come to be tested as much against current concepts in biochemistry as against their empirical results, which means they're not actually being put to scientific test. If you're only testing your ideas against the things you already believe and not against what you can actually see, observe through empirical results, and that's not a true test.
Yeah, that gives me chills, actually. It's so deep and accurate. Obviously, I'm not a doctor, and I didn't live through that experience of watching penicillin do what it did, but the recognition of the mental error that exists in modern medicine and, frankly, medical science is so clearly accurate.
Yes.
The one thing I would disagree with there is he says it was an art. It's now a science. And the problem is...
It's now a scientism.
Yeah. Well, two things. One, I think the distinction between these two things has to be drawn differently, right?
I agree.
In other words, science is an art, right? This is when Heather and I talk about the fact that you can't explain to somebody how to formulate a hypothesis. What they're doing, it's a skill. It's a skill that is not explicit, and you can model it, but somebody has to figure out their own path to do it. That's because the process of doing science being the method by which you figure out whether that hypothesis is valid, contains an art. If you're any good at it, it's not because you learned some series of steps that you can deploy, at a higher clock speed than the next guy.
You can describe the method that is science, and it will vary between disciplines, but observe, pose questions about what you have observed, formulate hypotheses that might explain those things that you have observed, formulate predictions that would inherently follow from those hypotheses, test your hypotheses, assess, repeat. Again, observe, hypothesize, predict, test, assess, repeat again and again and again. And we can teach how to try to observe both by method and by senses with as little bias as possible. And we can test and we can teach various methods that we have, materials that we now have, that we now can create, statistics that we can use with which to assess things that we will, the data that we will generate from the tests that we can again teach. But those second and third, depending on how you number it, steps, the hypothesis generation and the predictions that follow from the hypotheses. Actually, the predictions that follow from the hypotheses is a logical step that can be taught more precisely. But the hypothesis generation itself, as you say, it's it's closer to an art. It's closer to magic, and it's not.
I think it is an art. I think it's something, just as the sculptor wields the tool in a way that creates, a change in the stone, right? Yes, the sculptor is doing something that we could reverse engineer, but the sculptor somewhere deep within them has the feel of the tool and the stone, and it results in the depiction. And
when they look at the stone in advance, very often they won't. It is not at the level of consciousness that they know that they can tell that there is some vein deep in the rock that means they have to come at it from here rather than from there, or else the entire thing will either crack or just not be as perfect.
Yep. It's all happening at the level of atoms, but the point is that's not the interesting part of the process. And, if anybody who's very good at anything where it is intuitive to them, it's, I really like the idea, the term, it is second nature, right? Mm-hmm. Second nature is not your nature. You weren't born knowing how to do it, but you can get very good at something to the extent that you can, feel what's going to work. And if somebody asked you, how did you do that? You'll struggle to explain it, and you'll do, a passable job at best, because that's not how it's stored. But I just want to point out that I want to rescue science from the idea that it is an alternative here, because let's take the way this is described. Penicillin arrives, and it suddenly takes this pneumococcal infection and renders it curable with a little bit of this powder. How did it get there? It got there, story I did not know, that somebody lost a bunch of cultures because they had a bloom of this, I guess it's a fungus that...
it's a fungus.
They had an outbreak of something that killed their samples, and they put 2 and 2 together and said, I guess this kills that. What does that mean?
I wonder if that works in vivo.
Right. But the point is, there's no point in history where that becomes technologically tractable. There's no point at which you couldn't notice that, some of this arrived and it killed that.
That didn't happen to have... Whereas many things we are building on, we're on the shoulders of giants, and we couldn't possibly... There are ideas for which their time has not come.
Right.
This observation that this mold in the presence of these bacteria kill these bacteria was an observation that could have been made in Aristotle's time.
Right, exactly. So imagine, for example, you had a famine and you had some sick people, and ordinarily you wouldn't feed them the moldy bread because you don't. But in a famine, you might have no choice. And so the moldy bread, it cured the thing that was in the lungs. And does the moldy bread cure the lungs? That's a simple question that you don't need to have formal training. You don't need to know anything about what it means for bread to be moldy. You don't need to understand that there's biowarfare between microorganisms. You don't need to know that there are microorganisms at all. So the point is, does science work? Of course. The hypothesis is, I wonder if this stuff resulted in those people getting better.
Observation,
test it.
The people who ate the moldy bread fared better. Tougher to control in a non-lab environment, because what else were the people who didn't have enough to eat eating?
Right. But it's testable,
yeah.
Right? The point is, the next people who get sick, let's try the moldy bread on them. Oh, they got better too. I guess we failed to falsify that. So anyway, the point is, and let's take another one. This is one of my favorite examples. Acupuncture. We in the West look down on acupuncture. Why? Because the explanation that comes with it does not fit with our understanding of the body. And I believe it is, in fact, literally not true. Right? There's chi, and you are interrupting the flow of it with needles introduced at very particular places. Should that matter to you at the point that you have a chronic pain that you need to get rid of? No. The question is, empirically speaking, does acupuncture effectively reduce the pathology that you have? The question of whether or not the metaphor of chi is sufficiently accurate for you not to look down your nose at it is irrelevant. So I guess the problem is this. We actually have 2 traditions in the West. and one of them has given way to the other. We had a tradition of medicine where your doctor was a scientist and your doctor effectively experimented on patients, which is a dangerous thing to do. But, when your doctor was making house calls, if you lived in a little town and you were sick with something and the doctor came to your house and the doctor took a pretty good guess at what it is that you had based on all of the other people that your doctor has treated, and he knows what things tend to work and what things tend to make it worse, and he gives you the thing that he thinks tends to make it better, and instead it gets worse, and therefore he thinks you probably have this rather than that, right? That process is not here is a diagram of the pathways in the physiology of the body, and here is the place that we are going to intervene in order to increase this value on your chart. This is it is a therapeutic art. And the problem is that we now have what look like very impressive descriptions of physiology. I don't know if you remember at Evergreen, there were places in the buildings where these incredible charts of physiological pathways and their interrelationships are displayed. If you don't know how early we are, if you don't happen to be biologically sophisticated enough to realize that as impressive as that chart is, it's like a crude rendering of a small corner of human physiology.
Also, what you should think when you're looking at those charts is, my God, everything is connected to every other system. And if I mess with this, I have no idea what all else I am going to be affecting. And so the idea that a little biochemical switch, we're just going to interrupt this such that the downstream stuff doesn't happen, because you don't like that downstream stuff, because I've been looking at your chart and your numbers do not look good to me. Like, well, okay, what about all the other stuff that you didn't measure that don't have to do with the numbers that are downstream of that, but are actually, that was a endocrinological thing that we fixed. But what we didn't take account for was the muscle physiology and the neurological stuff and the circulatory stuff and, the bone density and the soft tissue connections and everything else, everything that we don't even have names for yet, or they do in Chinese medicine, for instance. And I suspect you talking about acupuncture is funny, because I suspect that in this book that I have not yet read, The Body Electric, that he will defend things like qi, because it is effectively an appeal to, we in the West have too long failed to understand energy and electricity specifically as one of the elements that are important to be keeping track of in a healthy human body.
My guess is that there is something that isn't quite, that this is a metaphor that is good enough for a practitioner to extrapolate usefully from it, even though we can't find the chi.
But right? I guess, so you've used this example a lot. I don't have a counter example off the top of my head, but I know for sure that there are so many things that we do in Western medicine that actually are kind of functional, but that are based on metaphorical explanations.
Oh, yeah.
And this is true just across the board. In fact, I was listening, we may come back to this another week, but I was listening to Jean-Jacques, the audiobook of Jean-Jacques Rousseau's Emile or On Education this morning, a little bit. And this is an Enlightenment thinker from the 1700s who is talking about how one should be educating very, very small children. I'm early in the book yet. And I believe I was just listening to it on my drive, and so I can't pull it up. I don't have the visual on it, which is usually how I can find things. But I believe he argues that milk is basically plant matter, because there is something that they could measure in the 1700s that renders it more plant-like than animal-like, and therefore wet nurses should be vegetarians. and listen to this as a modern, well, that's absurd. And, he's saying lots of stuff that makes a lot of sense. And then, this comes in on what basis is it plant matter? Oh, this is way before Darwin. This understanding of what makes you plant matter as opposed to animal matter is based on some, frankly, early reductionist understanding of we can measure this, and this thing that we can measure makes milk more like plants than like meat. Therefore, milk is plant matter. How many of those are we doing now? We have to be making so many of these errors, but we're so certain because we have the numbers. And the numbers on your chart do not look good, Mr. Harris.
Well, once again, Monty Python nails it. All right. You remember, so if she weighs the same as a duck, she's made of wood, and therefore a witch, burn her. Yes. Right. It's like that. You can hear if she weighs the same as a duck is like, 2/3 of the way to density, right? Right. But it's not all the way there. It's not good enough to use, right?
But they're onto something.
Right.
Until they're really not onto something.
But I mean, I guess that's the point. Right. You and I know, because you and I are focused on complexity versus complicatedness. You and I know how early we are in the study of biology, and therefore that those incredibly impressive charts about human physiology are not a proper description of how the thing works. They are focused on that which we know, and radically exclude all the things that we don't know and all of the implications of the interventions. But therefore, what you really want in somebody who is in charge of your health, whether they are at HHS or whether it's the doctor that you're seeing in the clinic, is you want somebody who is enlightened in the likelihood of successfully intervening on your behalf without doing harm. Mm-hmm. If your doctor is pretty convinced of their own ability to intervene in your health and not terribly worried about the side effects, that's not the doctor you want.
Especially if that doctor gets his sense of his own infallibility from some other experts.
Yeah.
And is not willing to stray from the chart of actions to perform and actually engage you and do diagnosis on his own, and potentially come to a conclusion that is different from what has been printed for his use and which will be accepted by the insurance companies.
And frankly, it is the nightmare of the standard of care.
Yes.
Right. Your doctor's confidence that they can look you in the eye and tell you what it is that you should be doing and that it is in your interest to do it is not coming from the fact that they even have an understanding of what's on those freaking charts. They don't, right? Those charts would be painstaking to memorize. And even if you did memorize them, it's not a functional model that you could utilize. But what they're really proceeding from is a faith that the system that generated that chart knows what it's doing, and that they are a little node that can dispense the wisdom from the chart in a way that is beneficial to health, because all of the stuff that went into producing the chart was all, top quality stuff.
It patently took a lot of work, did it not?
It did, mm-hmm. But, you want to know how well this works? Learn the lesson of COVID, right? Because they presented an absolutely united front that gave you, what was the terminology we were playing with? It was, it was socially credible rather than analytically credible.
Yeah, social reality rather than physical reality, yeah.
Yeah, and the fact is it was enough. Yep. It was enough to kill. It was enough to give you cancer. And, they said it to you with confidence. If they had said, look, we're in a pickle. We don't know what to do. I think this is in your interest to take, but it's not without its risks. Mm-hmm. At least we would be able to look them in the eye now. But having said, it's safe and effective, and then it turns out to have been neither, mm-hmm. The opposite. Literally, it was radically unsafe, and it made you more likely to get COVID. It was the inverse of safe and effective.
Yep.
Right? Having told us it was safe and effective, and then it turns out to be the inverse of that. Now, one goes to the doctor with trepidation, and it's their own damn fault, because they were reporting something based on a kind of faith, and they were reporting it as if that faith was actually a scientifically justified extrapolation, and it was nothing of the kind.
Right. Well, and most doctors weren't just reporting it; they were requiring it.
They were browbeating us for daring to question them, even when it was obvious that there was way too much confidence being deployed given the emergent nature of the situation and the remedies.
That's right.